As soon as he started pushing against my bone, it hurt so bad that I'm pretty sure I let out a small scream. Hi, I'm Tatiana, I'm 21, and I was just recently diagnosed with classic Hodgkin's lymphoma. This is basically my experience with my bone marrow biopsy, as the title says. If you've been diagnosed with a blood cancer, any cancer really, then you know once you're diagnosed, there are some tests that need to be done to be able to determine which stage you're in. That way they can find where your cancer is, if it's located exactly where they found it, or if it's moved around in your body, and figure out which treatment would be best for you. So part of my staging was a PET scan, a biopsy, and then the bone marrow biopsy. Because in my PET scan, my spleen showed that it was involved, basically, that there is something weird going on there. And that already put me at 3B. And my doctor wanted to make sure that it had not also moved on to my bone marrow. He suggested that we get a bone marrow biopsy done. Now, if you've heard anything about bone marrow biopsies, then you probably know that they are pretty painful. I had heard around and read in different books about how when you get bone marrow biopsy done, it is not the most pleasant experience. When my doctor said I would need one, I immediately asked, well, how bad is it gonna hurt? What should I expect? How do I prepare? He told me that the way he does it is that he gives you oral sedatives to take an hour before the procedure. So by the time that you get to the procedure, you're pretty knocked out, pretty out of it. And so it doesn't hurt as bad as it normally would. And he also does local anesthesia around the area where you're gonna get it done, which for me was the back of my hip on the right side. They told me that he'd use the sedatives and the local anesthesia combined to try and make it as pleasant as he could for me. I don't know why, when he told me this, I didn't think to mention the fact that I tend to be a little resistant to anesthesia. In the past, I have woken up inside the operation room in 2 different occasions that I can remember. Maybe it's been more, I don't know. I've woken up while they were still operating on me, and they had to basically knock me out again, and I can remember all of that. So I don't know why at the time I didn't think to mention that to him. I probably should have. I didn't mention it. So that was on a Friday, and then on Monday I had to go in and get my bone marrow biopsy done. And the way this went down was that when I was leaving my house, I took the 2 pills he had given me, because my house is around 45 minutes away from his office. And I knew I'd probably have to wait a little bit for him to actually do the biopsy, so it would come down to around now, maybe an hour and 15 minutes. By the time we get there, I'm not really feeling any different, sedated at all. And like I thought we did have to wait a little bit, about 15 minutes, 20 minutes for him to call me in. So by that time, the hour had already passed where I was supposed to be feeling the effects of the sedatives. And as I walk into his office, he literally asked me, do you feel anything at all? And I'm like, no, I feel normal. And I was just walking around completely normal and completely fine. Already then I could see it in his face that he was kind of worried for me. But I was trying to keep calm myself. But he's like, well, let's just move on to the room and get you prepped, get you ready. And he told me to lay down in a fetal position, basically staring at the wall with my back to him so he could have access to my hip. And he sterilizes the whole area and all the prep work that needs to be done on the skin to make sure that it's, sterilized and ready. And then he goes in with the anesthesia. Guys, oh my god, that hurt so bad. It burned, literally burned when he injected that into me. At that point I was already grinding my teeth and kind of slow, low moaning. And he was like, oh, it's okay, you're okay. And in my mind, I was thinking, this is probably the worst part, right? Because after this, you're sedated and you won't feel anything, and this has to be the worst part, right? So after he did the anesthesia, he didn't really tell me what he was his next move was going to be, which I appreciated because I didn't really want to know, because your body kind of tenses up when it's anticipating pain, and that usually makes it worse. So I kind of appreciated that he wasn't telling me what he was doing. But I did feel it because as soon as he stuck the needle inside, I felt everything, like everything. As soon as he started pushing against my bone, it hurt so bad that I'm pretty sure I let out a small scream. At this point, he realized how much he had failed to sedate me and numb the area. And he was like, wait, does that hurt? And I was like, yeah, it hurts. And then he was like, well, I'm really sorry because I can't really like do anything at this point. Like the needle's already in. He couldn't just take it out basically and give me more anesthesia. And really, what would it do? Like, though he had taken his time with the anesthesia. He took a solid like 5 minutes injecting me with anesthesia. I should have been done for. Like, I should not have felt it, but I did. So he really had no choice but to keep going, and keep going he did. He pushed the needle in through my bone and I felt it, and he went to aspirate what is called the liquid marrow, because it's divided in two. It's first they aspirate liquid marrow and then they take an actual sample of solid bone marrow. Before he aspirated the liquid marrow, he did tell me that I would feel kind of a hollowness because it would leave, you know, the space hollow inside because he's gonna suck it all out. And as soon as he's done saying those words, I felt the most intense pain I've ever felt in my life until that point. And let me just tell you, I do not have a low pain tolerance at all. I have been dealing with chronic pain for a year now due to sarcoidosis, and then whenever the heck the freaking lymphoma decided to pop up, I've been dealing with that pain for a year now. Before that, I've had like terrible periods. I had to be medicated when I was like 14, 15 because of how bad they were. Like, I've known pain. Still, I can tell you with 100% certainty that that is the worst pain I've ever felt in my life. So when he pulls out the liquid bone marrow, I immediately feel the pain travel from where I'm assuming the needle was all the way down my right leg. Like, all the way down. And I'm telling him this, I'm like, I can feel it in my leg, I can feel it in my leg. And he's like, yeah, you can feel it in your leg. Yeah. He's just saying I'm sorry over and over again because he didn't think I'd be feeling all this. Obviously. Meds. But I did. I felt all of it. So as soon as he's done with that, he tells me, okay, it's good, it's liquid, you know, we got a good sample, because apparently sometimes with cancers, you can be missing some minerals or have too much, and that causes the bone marrow that's supposed to be liquid to solidify, and it makes it really, really hard to get a good sample. And I was lucky in that mine was liquid, so he was able to get a good sample. Because if I had to go through that again. Now, this is when I realized, wait, you just got the liquid sample? You're only halfway done? At that point, I got really desperate because since I could feel everything, basically what was coming out of my mouth was moans, screams, a jumbled of please hurry, this hurts, because I did not have the strength to control what was coming out of my mouth. I was trying to control my body because, of course, when you feel pain, you're gonna try and get away from the source of the pain. And if I moved, if I flinched at that point, I could ruin the sample, damage the needle, have it break inside of me, or just ruin the procedure and end up hurting myself. So I was trying to control my body and not move at all. So whatever came out of my mouth during those 10-15 minutes, I should probably apologize to my doctor. At that point, after all of that torture, he was only halfway done because we still needed to get the solid bone marrow extracted. And oh boy, if I thought the liquid bone marrow was bad. When he asked me if I wanted to see the needles, I said no. And I'm guessing he asked because I'm a pre-med student, so I'm generally very interested in knowing about the medical aspect of things. I ask a lot of questions. But that day, I was not in my medical student mode. I was in full-on patient mode, and I did not want to see those needles. I never looked at them even after the procedure was done, but the way my mom described them to me, because she did see them, she saw them actually after the procedure when they were filled with my blood, which is horrifying. She described them as extremely large, and there was one that was kind of curved, and basically they're scary needles. I'll probably try and like insert a picture here or here, I don't know. But they're giant needles and they're painful needles. So when he went in to get the solid bone marrow, he didn't tell me he was going to do it, but I immediately felt the pain and it was awful. Before that, I had been moaning. I had been, letting a tear or two out and just kind of grinding my teeth, and it had been fine with just that. But as soon as he went in to get solid bone marrow extraction, I screamed. Like I actually screamed. I could not control it. Like awful. And he just kept telling me like, please, like you need to stay still. Like I'm almost done, I promise. Like I'm trying to hurry, but you need to stay still. So I'm literally just in fetal position, staring at the wall. His wife, my doctor's wife, is also his nurse. She's an oncologist nurse. That's what she studied. So it just happens to work out for them. And she was in the room with us and she was holding my hand, bless her. She was letting me squeeze the literal life out of her hand as she tried to like rub my leg with her other hand to try and calm me down. And I'm just screaming and squeezing this lady's hand as he's extracting a solid piece of my bone marrow. And that probably did not take more than 3-5 minutes, but to me it felt like literal hours. It hurt so bad. At that point I was sobbing, like full on sobbing. I couldn't control it, like with hiccups and everything, like a little baby. And he just kept apologizing and just trying to get me to calm down, but there was no calming me down. It was awful. I just kept begging him to please hurry up. I remember that part, just like me just going, please hurry up, please. And yeah, I don't know how he decided to keep treating me after this. Like, what a horrible experience for both of us. And after he finished removing it and he got the sample, the pain almost immediately like went away. Still kind of hurt and it still kind of felt sore, but nothing compared to when the needle was actually inside and he was like removing the bits of bone marrow, because it's literally how they have to like freaking pull it out, and he has to make sure that it comes out in one piece, because if it breaks inside then the sample's ruined and we have to do it all over again, which is why he kept telling me to just stay still and try not to ruin it. But almost immediately as soon as he took the needle out, like the pain was like subsided and I felt better. But I was incredibly shaken up with the whole experience. He showed me the little jar, and it's basically a small jar about this size, and they fill it up with the liquid marrow and the solid bone marrow all in the same jar. The liquid marrow, he told me that mine came out with more blood than expected, so it was kind of like pink. And the solid bone marrow just looks like very thin, long blood clots, which to me was, I don't know what I was expecting. I was expecting it to look more like bone, which probably sounds really stupid, but that's what I was expecting. God, my samples were viable and they were good to go, sent off to the lab, and I didn't need to be put through any more pain after that. So when he was done, they put a band-aid on me, because actually he didn't have to make an incision or anything. So the band-aid was rather small, and the holes that the needle makes are the size of the needle, which, for it to be a needle, it's freaking huge, but the actual hole that it leaves behind is not that big. When I saw that small hole that left, I felt like those memes of men's soccer players that like you touch them and then they throw themselves on the ground and they start screaming in pain because the hole was so tiny, and I just remembered myself just screaming and crying over that like tiny incision in my back. It's kind of ridiculous. After he was done and after he took out the sample, like I said, most of the pain was gone, but I was still very shaken up because the experience was awful. So he let me go into another room and kind of sit down, try and calm down, and then my mom and my grandma that had been waiting for me in the waiting room came in, and they were like flooded me with questions. They were like, are you okay? Like, were you crying? Like, how was it? Like, are you okay? And at that point, I was just feeling so shitty that I was very, very rude, and I was like, please, like, don't talk to me. Like, please shut up. Like, I can't deal with you right now. Like, I can't deal with anyone right now. I need to, like, calm down. And I tried to breathe and just calm down and just kind of, like, try and get myself as relaxed as possible because I was just way shaken up after everything. And as I was about to leave, my brilliant mind suddenly thinks, do I have to go through this again? And so I asked the doctor, do I have to go through this again? And he tells me that, well, first of all, he was like, he looked at my mom and he's like, she always asks the worst questions. And yeah, I know. And he just told me that basically if it came back positive, then yes, I would have to get it done again in the end of my treatment to make sure that all of the cancer was actually gone. But if it came back negative, then I would not have to get it done. But just the idea of having to go through that again made me literally break down. Like in front of him, in front of the doctor, in front of my mom, in front of my grandma. Like that is how badly shaken up I was after all of this. I just started sobbing. And my mom's like, but he said maybe, like it's not, like you don't know yet, like just calm down. And I could not calm down. It was awful. After that, most of the pain subsided. It stayed sore for a couple weeks. It's actually still kind of sore now. It's like 2 weeks later. But it's sore in the way, like if I touch it or if I lay down too hard leaning on that side, I will get some soreness, and sometimes I do get lower back pain. But he said that's normal. All of that's pretty much normal until the whole area inside heals. So yeah. So if you came here expecting me to be like reassuring, if you're gonna get the procedure done and you wanted someone to be like, it's gonna be okay, then I'm really sorry. But this was my experience and it probably won't be yours. Like I said, I'm just very resistant to sedatives. I'm resistant to anesthesia. It's my luck, you know? Probably not going to be your experience if sedatives and anesthesia have been known to work for you in the past. So don't worry too much about it. I have heard from some people who literally didn't feel anything at all. Like it was just a normal procedure for them, like getting their blood drawn, and it was over super quick and they left and it was fine. Try really not to think about it until you get there. Again, it's a relatively short procedure. I think it was like 15 minutes, maybe 20. If you do end up getting short stick like me, just remember that it's gonna be over soon and it's really, really necessary. Like they need to find out if your cancer is affecting your bone marrow. They need to know so they can properly treat you and you have a better chance of beating its ass. So just keep that in mind through everything, not just the bone marrow biopsy. Any prep that you need to get done, just know that's very necessary and it'll be over super soon and you will be okay. If you've been through this, if you want to leave a comment down below and share your experience, I would love to read them. If you have any questions at all, maybe I didn't mention in the video, also leave it down below. I'll try to answer as soon as I possibly can. And I actually just had my first chemo, my very first chemo yesterday. So far, haven't gotten any terrible side effects. I was told that third day is worst day, so I'm still holding out. I will be filming a video about that, about my whole experience with my first chemo, but I'm gonna be waiting at least 2 weeks so I can really get a feel of what those symptoms are, especially because, you know, hair loss, if I'm going to go through it, will start kicking in after the second week. So, and I want to make a video that is fully a representation of what the chemo is like. So subscribe if you want to see that video or videos of related content to, you know, my classic Hodgkin's and my journey and all of that. You can click the bell button too if you want to receive notifications whenever I post, and like the video if you enjoyed it, and I'll see you next time.